Pharmacist Interventions Part 3. So with the Adderall shortage, I thought it'd be interesting to touch on the subject. I've had patients struggling to get their Adderall XR, so they're switched to Vyvanse. However, Vyvanse is more potent than Adderall. I've had providers just switch it 1-to-1. That's not a 1-to-1 substitution. Say if patients on an Adderall XR 10, they should probably switch to Vyvanse 30. So I've had that discussion with providers to make sure that we're getting equal potency there. So Vyvanse is a prodrug, meaning it metabolizes into the active form. It's called lisdexamfetamine. It's going generic this year, which is pretty exciting. It's metabolized into dextroamphetamine, the R isomer of amphetamine salts. So another intervention that I make is for my patients who are picking up Plan B. There are some studies that show that patients of higher weight who did take Plan B were just as likely to get pregnant as patients who have not taken Plan B. I'm talking about one Plan B for my higher weight patients. Oral contraceptives interventions that I make are oral contraceptive being like birth control, like Sprintec, Vestura, something like that. So patients who smoke or patients who have migraine with aura should not be taking estrogens because it increases the risk for stroke. It's a direct contraindication. So I do counsel my patients who are on combined oral contraceptives, meaning an estrogen and a progestin, and recommend something like Slind. Slind is drospirenone. It's a second generation progestin. It's also anti-androgenic, meaning that it blocks androgen receptors. It's good for hormonal acne. It's also potassium sparing in nature because it's kind of like spironolactone. They both have similar drug structures. But I do enjoy Slind recommendations for my patients because it doesn't carry the increased clotting risk, increased stroke risk, and it also helps with hormonal acne. Another intervention that I make is patients that I see who are chronically on Miralax. I've had patients who are prescribed like a pound of Miralax with 11 refills, and they're taking it every single day. It's not a good thing to do. It's usually primary care providers setting this in, not gastroenterologists. I counsel them on electrolyte abnormalities, and then I do recommend a gastroenterology referral at that point due to dependency on the laxative. You want to see what's causing the gut to not move as well, and then also cure that cause.